Hey everyone, in this video I'm going to go over tricep tendinopathy or tendonitis, where the tricep tendon on the back of the elbow here, where it inserts, becomes irritated and inflamed. We're going to go through some different pain alleviation techniques, stretches, and also some strengthening exercises to try to reduce your pain and improve your functional use of your upper extremity. One of the first and easiest things you can do at home is use a heating pad or an ice pack. That works really well. That's just preference as to which one you want to use. You also can use those topical analgesic creams. Make sure you don't use the cream in conjunction with a heating pad or ice pack because that can irritate the skin. Those work really well at just trying to kind of calm things down so you can go about your day and then also tolerate your rehab program. Another great technique, if you're safe to be able to use the TENS units or home electric stim units, which you want to make sure and be cleared by your doctor, make sure that's okay. But you can use one of these stem units to put the pads, or you can vary the placement. I have one pad below my elbow, one pad above. You can really kind of play with that and see where it feels the best. You can use that in the area to kind of calm down the pain a little bit. Those work really well, especially like at nighttime when you're trying to get some alleviation, trying to go to sleep, and you can put this on for a little bit just to make things feel a little bit better so you're not always just in that constant pain. You can also use percussive massagers. They work really well. I'll put a link in the description for one of these, but you can just kind of use this and go all around the back of the area, just the tricep, the muscle belly itself. If you get down to the bony portion down here where the tendon's inflamed, that can be a little uncomfortable, a little painful. So you may want to stay away from that. A lot of these massagers, you can change out the ends. They kind of pull apart, and you can change out what the ends are. Some of them are a little softer than others. If not, if you don't have one that has a changeable head on it, a lot of times I have patients wrap a towel in the area and kind of go on top of the towel just to kind of create a buffer. And that works really well. It's just reducing the pain and also increasing the blood flow to the area. Next is going to be stretching the tricep. Now the tricep crosses both the shoulder joint and the elbow joint. So you can really vary this and kind of play with what feels like it gives you the best stretch. One of my favorite ones to do is really easy, is just bend the elbow, take the other hand and push that back. You're gonna feel that stretch on the back side of the arm there. You're gonna hold that for around 10 to 20 seconds. You can hold it longer if you'd like, repeating that several times a day. To make that stretch a little more difficult, you can reach behind the head and kind of bring the arm up or bring the elbow back. That's gonna stretch the entire tricep, both the portion that's crossing the back of the shoulder joint, as well as making sure that you're stretching that portion down by the elbow. Next, we're going to take a tennis ball or a myofascial ball. Again, if you watch my videos, you know I'm a fan of using tennis balls. We're going to place this down on a hard surface. It can be a countertop, whatever. Come right in with the back of my arm here in the tricep area, really pushing down, kind of moving that around. Even though you don't get down necessarily on the tendon where it's inflamed down here, just working into the muscle belly of the tricep works really well. It usually feels pretty good, just kind of rolling back and forth. I'm applying a moderate amount of pressure. And you can even just statically hold that still. And you're gonna notice in a lot of cases, you're gonna have some pain alleviation with that, a little bit of tension relaxation here within the muscle. Now we're gonna start our strengthening exercises. This is gonna be an isometric contraction. That's gonna be where there is a muscle contraction and there's no joint movement. So an isometric, I'm trying to straighten out my elbow or extend my elbow, is gonna look like this. I'm gonna put the back of my forearm on the towel here or blanket, whatever you're using, and I'm pushing down. So I'm trying to straighten out my elbow. What's gonna happen is I feel that muscle contraction back here, I feel my tricep contracting, although you don't see any joint movement. I contract, I push down into the table or the mat, whatever you have. I'm gonna hold that about 5 seconds, maybe 10 seconds with a minimal amount of force originally, and I'm gonna work up to putting out more effort. I'm gonna hold that, relax, tighten up my tricep again, trying to straighten out my elbow, pushing down. Gonna hold that again and relax. Repeat that for about 10 repetitions for 2 to 3 sets. Over the period of about 7 to 10 days, I usually have my patients progressively push a little bit harder. Maybe they even hold it now for a good 10 seconds, pushing pretty hard. You may visibly see a little shaking here, that's okay. Again, it's also okay to have increase in pain when you have a tendonitis or a tendinopathy where that tendon is irritated. It's normal to have pain. In fact, if you don't have pain or a little bit of pain increase while you're going through your exercises, you're probably not doing enough. There's not enough load or tension going through that tendon to enhance the healing process. Now that you've been performing your isometric exercises, pushing down into that pad for about 10 to 14 days, we're gonna start using one of these exercise bands. We're gonna start what's called an eccentric movement. So this is gonna be a little bit different than traditional, just straightening out the elbow, going back and forth. What you're gonna do is take an exercise band, take your unaffected side, and you're gonna hold it up a little higher. You can fasten this to a doorway, or a lot of those band sets come with a way to kind of fasten it to the top of the door or the wall. And what I'm going to do is I'm going to straighten out my elbow all the way. So my elbow is straight. Now you can put this down by your side or hold it out here. It doesn't really matter. And what you're going to do here is I'm going to pull up on the band and I'm slowly bringing my hand towards my shoulder. The whole time I'm kind of raising my arm up a little bit. When I get to the top, straighten that back out, straighten my elbow all the way back out. Pull tension on the band, so I'm having to resist the band, otherwise my elbow would come up. And then slowly bring my elbow up, elongating my tricep on the back side here as I come up. Relax and come back down. And you're gonna repeat that for about 10 repetitions for 2 to 3 sets once a day. This is just gonna be an alternative version of using that piece of band that I had. This strap is fastened on the top of the door here. What I'm going to do with this is I'm going to straighten out my elbow here, take a hold of the strap. I'm going to slowly bring my hand up. I'm going to use my other hand, kind of pull the strap down, straighten out my elbow, and then slowly bring that up. You're going to kind of feel a burn in the back of the arm there. And I just keep repeating that for around 10 repetitions for 2 to 3 sets, 1 time a day. After you've been performing your band exercises for overall around another 10 days or so, that's not written in stone. That's not exact. It just depends on how you feel. I may have my patients do each portion maybe a week or maybe 2 weeks, just depending on what your pain feels like and just how you feel with progressing your program. You're going to use one of these, like a pull down machine or a tricep rope machine, or you can even use just a pulley system if you have one of those that just fastens to power racks and all. What you're going to do with this is bring your elbows by your side. You're going to straighten out your elbows and then slowly bring this up. Nice, slow, and controlled. You're going to want to use a weight. Initially, you can perform this for about 15 repetitions, maybe even 20 repetitions. We're just trying to get some of the blood flow in there. And then eventually, you're going to work up, increase the resistance on the weight after around maybe a week to 2 weeks, where you're completing about 10 or 12 repetitions. And by that 8th repetition, it's getting kind of hard. And by 10 or 12, you're kind of maxing out on that. You're putting out a pretty good bit of effort. Really feel that burn back there. Again, remember, pain is normal while you're going through the program. Even if it increases your pain a little bit, that's completely okay. Next, what you're going to do while you're performing those rope extensions or machine pull downs, at the same time, I also start having my patients perform kind of some chair dips or chair push-ups. So what you're going to do with this initially is you're going to start with, you can put your palms facing back, just kind of here beside you, or you can use the armrest of a chair. Just remember, if you use an armrest, you bring your shoulders back like this. It's a little more strain on the triceps. So initially, I just have my patients put their hands in the chair. I'm going to contract my triceps, really try to straighten out my elbows and kind of push myself up. Now, not a lot of movement happens there. Just feel the contraction and then relax. I push down, almost kind of pick my bottom up off of the chair. Hold that, maybe 2 to 3 seconds and relax. Repeat that for around 10 repetitions for 2 to 3 sets. Once you feel comfortable just pushing down through the chair, you can progress to using the arms. We're going to push down almost like a chair dip and back down. I'm using my feet to kind of assist this movement as I come back and forth. If it's too painful to lock out your elbows at the top, that's okay. You can come short of locking out and come back down. That works really well. Perform that for 2 to 3 sets of 10 to 12 repetitions. Now that you've been performing your program for around 6 weeks, you can start returning back to machine presses or chest press machines. I also have my patients wait a little bit sometimes for going back to dumbbells or even barbells. Just kind of have to wait a little bit, see how you feel. I usually like to go to machines or a cable system first, and then after they feel pretty confident with that, maybe 2 weeks or so performing that, then you can go back to your free weight movements, your power racks, all those kind of things, and typically that works out really well. Thank you so much for watching. I hope this video helps with your tricep tendon pain. Make sure you subscribe to my channel, that way you can stay up to date on all my content. Thanks again.